Normally, the urine is sterile, meaning there is no bacteria in it. But lots of different things can make people have some bacteria in their urine all the time. Older age or not emptying your bladder all the way can do this, but so can using a catheter to empty your bladder. In this video, we will focus on people with neurogenic bladder who use a catheter to empty their bladder. The number of bacteria swimming around in the urine will go up and down from day to day, but they only cause an infection when they invade the wall of the bladder and get deeper into your body. When the number of bacteria is low, you won't even notice it. When the number of bacteria grows, the urine can get cloudy and smell bad. But don't worry, this is still okay. When this happens, you still don't have an infection because the bacteria are just in the urine, not in the bladder wall. Once the bacteria are in the bladder wall, they'll cause problems like bladder pain, feeling like you need to pee, leaking of urine, or even a fever. Now let's talk about facts versus fiction when dealing with UTIs. Should I get urine testing on a routine basis to check for a UTI? No, you shouldn't. Your urine will almost always test positive for bacteria, especially if you use a catheter. Regardless of whether the bacteria are just swimming around in your urine or they are actually invading into your bladder. So, testing your urine on a regular basis when you don't feel like you have a UTI will not tell you whether an infection is present or not. Should I only test my urine when I feel like I have an infection? Yes, you should. When you have symptoms like increased leakage of urine or fever, this could be a bladder infection. The bacteria could have gone from just swimming around in the urine to irritating the bladder lining. A positive urine test is much more meaningful when you have these symptoms. So you should get your urine tested when you have symptoms and only when you have symptoms. If my urine test is positive for bacteria, should I get antibiotics? No, not always. You should only get antibiotics when you have a urine test showing infection and you feel like you have a bladder infection. If you use a catheter to empty your bladder, your urine test will almost always be positive. If I take antibiotics to clear the bacteria living naturally in my bladder, will they grow back? Yes, they will. If you use a catheter or for some other reason always have bacteria naturally swimming in your urine, then you should only take antibiotics when you have an infection. If you take antibiotics to try to kill the bacteria that are there all the time, then they will just come right back. If I take antibiotics too often, will I get superbugs in my urine? Yes, you will. One of the reasons you want to avoid taking antibiotics is because too many antibiotics over your lifetime will make the bacteria more resistant. Eventually, we will run out of options for antibiotics to use for treatment. Then once you have an infection, it will be really hard to treat you. Will drinking more water prevent or treat a UTI? Probably yes. Drinking more water and cranberry juice probably does help. When we drink lots of water, we make more urine and we pee or catheterize more often. This flushes out the bacteria in our bladder before they grow too much. Cranberry juice is often used to prevent UTIs. Cranberry juice makes the urine more acidic, and the bacteria don't like this because they don't grow very well in acidic urine. But you need to drink lots of glasses of cranberry juice every day to change the acidity. Some people take over-the-counter cranberry pills, which are stronger than cranberry juice. Unfortunately, there is not enough information on the effects of these supplements for a neurogenic bladder to know if it is helpful when you use a catheter. If you actually have an infection, it doesn't matter how much cranberry juice or water you drink. It will not kill the bacteria invading the bladder wall. However, it may help the urine from getting too cloudy and smelly. Remember, if you have symptoms, go see your doctor.